Ensuring adequate intakes of vitamin D and calcium are simple, low-cost, and incredibly beneficial interventions. Vitamin D supplements, when taken in combination with dietary and supplemental calcium, have a huge impact on residents' health, significantly reducing falls by 20% by improving muscle function, body sway, and coordination, reducing muscle pain, improving bone density, and reducing other debilitating effects of osteoporosis. Plus, there are no side effects. The recommended daily dose of vitamin D is 1,000 to 2,000 international units, as residents will not get enough through their diet. Sunlight promotes the skin's synthesis of vitamin D, but sun exposure to meet the vitamin D requirements for residents is challenging in northern climates. Plus, aging skin doesn't convert vitamin D as effectively anymore. Plus, sun exposure is a known risk factor for the development of skin cancers and eye disorder. It's therefore better to obtain vitamin D through supplementation. Our bodies carefully regulate their supply of calcium, so it's important for residents to regularly consume calcium through food and supplements to prevent their bodies from taking calcium out of their bones, thus making bones more fragile. Understanding which foods are the best sources of calcium is important, so caregivers can encourage residents to eat those foods. Homes can also promote calcium-enriched menus, flag dietary care plans, and use fortified foods and beverages. The recommended daily intake of calcium is 1,200 to 1,500 milligrams. If residents are unable to consume enough calcium through their diets, then calcium supplements are recommended, starting at 500 milligrams. Bloating and constipation are common side effects from calcium supplements, but these can be minimized by dividing and gradually increasing calcium supplements, giving no more than 500 milligrams at a time.
What are the recommendations for calcium and vitamin D? Before we go into the recommendations, we need to consider some special issues in long-term care. Over 7 to 40% of residents living in long-term care have difficulties with swallowing. You need to think about supplement options, including pills that may need to be crushed or mixed with food, liquids, or another route of administration. If you suggest liquids, think about the thickness and mixing with foods. Similarly, fortified foods might help improve the use of vitamin D. For all residents, we recommend dietary interventions to meet the recommended dietary allowance for calcium. For those over 70, the recommended amount is 1,200 milligrams per day, which is 3 servings of dairy or dairy equivalents. For residents at high risk who cannot meet the RDA for calcium through dietary intake, we recommend daily supplements of calcium up to 500 milligrams a day. For residents who are not at high risk of fractures who cannot meet the RDA for calcium through dietary intake, we suggest daily supplements of calcium up to 500 milligrams a day, depending on resources and their or their caregivers' values and preferences. For vitamin D, residents at high risk of fractures, we recommend daily supplementation of 800 to 2,000 units of vitamin D3. For residents not at high risk, we suggest daily supplements of 800 to 2,000 units of vitamin D3, depending on resources and their or their caregivers' values and preferences. In summary, the goal of these recommendations are to improve the lives of seniors residing in long-term care. First, determine the risk of fracture on admission, asking the questions reviewed previously. Nutrition, calcium and vitamin D supplementation should be considered first. Exercise, hip protectors, and interventions to prevent falls and fracture are also recommended. Consider pharmacological therapy for residents at high risk of fracture. For access to the recommendations and other tools and resources, please visit the following websites: Osteoporosis Canada, Canadian Medical Association Journal, and the Jarrah Center.